Hi there! Did you know that numerous studies demonstrate how important it is for kids to have a good overall development? So I want to ask, how are your children? Early experiences have a significant impact on a child's future physical, emotional, and social development, which begins as early as infancy. The best investment we can make in their future and the future of this nation is to make the most of their formative years. If you have the means to support your child's educational and developmental needs, then this is simple enough. But what if you don't? Numerous families throughout the Philippines are dealing with this issue. Fortunately, there is a solution. The Philippine government recognized the need for early childhood care as early as the 70s when Presidential Decree 1567 required every barangay to have a daycare center. In the years 2000, Republic Act 8980 established a national child care development system. The Early Childhood Care and Development Council is the primary agency that supports the governments of sustainable and educated early childhood care development programs such as health, nutrition, early education, and social services. The Philippines has a 6 to 12 age range for the mandatory commencement of school if relevant. The Early Childhood Care and Development Act, or the Philippine Republic Act 8980, is a law that establishes a comprehensive strategy and national system for early childhood development while also allocating funding for other purposes. It is the policy of the state to promote the rights of children to survival, development, and special protection with full recognition of the nature of childhood and its special needs. The state shall institutionalize a national system for early childhood care and development, or the ECCD, that is comprehensive, integrative, and sustainable.
The Early Childhood Care and Development or ECCD system refers to the full range of health, nutrition, early education, and social service programs that meet the basic and comprehensive needs of young children from birth to age 6 to promote optimal development. According to Section 4 of the Republic Act 8980, these programs include center-based programs such as the daycare service established by the Republic Act 6972, public and private preschools, kindergarten or school-based programs, community or church education programs started by the non-governmental organizations, child centers and health centers, and home-based programs, such as for those neighborhood playgroups, family daycare facilities, parent education centers, and home visitation services. The Republic Act 8980 aims to increase newborn and child survival rates, promote young children's holistic development, enables a seamless transition from care and instruction given at home to the community and the school, ensure that young children are appropriately ready for the formal education system, and establish an efficient system for early identification, prevention, referral, and intervention for developmental disorders and disabilities in early childhood. Strengthening the function of the parents and other caregivers as the children's primary educators, boosting service providers and their managers' capacities, strengthening and continuing community-based efforts to promote ECCD initiatives, and raising the bar for ECCD programs, both public and private, are also its objectives as per mentioned in the Section 3 of the RA 8980. Its mission is to strengthen a system that raises awareness towards the improvement of the quality of life of young children 0 to 6 years old, their families and communities through cooperative and collaborative delivery of services in health, nutrition, early education, and social development. The ECCD system includes 5 components according to the Section 5 of the Republic Act, which are the following: ECCD curriculum, where health and nutrition, early learning, psychosocial, and cultural activities are all included, which is a term used to describe learning activities and materials that are developmentally and culturally age-appropriate. Parents and community involvement, which refers to enhancing the role of parents and the community as active partners in ECCD projects and programs. Human resource development programs that aim to improve the fundamental competencies of program managers, supervisors, and service providers for ECCD. ECCD management, which are the procedures for ECCD programs planning, execution, supervision, financial management, monitoring, and evaluation. Quality standards and accreditation, which make sure all ECCD programs and system components adhere to quality standards. The Early Childhood Care and Development Council is the primary agency responsible for supporting the government's effective and sustainable early childhood care development programs such as health nutrition, early education, and social services. The National Child Development Center, or NCDC, is the national learning center that showcases the best practices of integrated ECCD services. It is a flagship project that supports the various programs of the Council. It also serves as a research and development lab for ECCD. Similarly, it serves as a community resource center for improving parenting skills and capabilities. Cities and municipalities that are willing to participate and prioritize the ECCD program in their communities receive funding from the ECCD Council. And as a counterpart responsibility of the LGUs, they provide facilities and a child development teacher who will be trained by the ECCD Council. The National Child Development Center is the ECCD Council's flagship program. The NCDC is a child-friendly facility that serves as the first school for children at the barangay level. Its main goal is to provide and expand access to quality early childhood care and development, as well as the importance of the early childhood care and development. Its impact on brain development, economic gains, and school readiness, health and nutrition, and advocating for children's rights. The vision of the Early Childhood Care and Development Act is for Filipino children aged 0 to 6 years old whose rights are protected and promoted and whose potentials are developed to the fullest regardless of their condition, socioeconomic status, gender, religion, and cultural diversity.
Early childhood care and development, or ECCD programs, help to improve school performance as well as reduce dropout and repetition rate, which this is ultimately to reduce cost and improve efficiency of primary education. It also has a long-term impact on country's education, health, moral and social values, and children's development as a whole. The national government agencies, local government units, non-governmental organizations, and private organizations that are accredited to deliver the services or to provide the training and technical assistance will share joint responsibility for the implementation of the national ECCD system. As stated in Section 8 of this Act, national government agencies are in charge of formulating policies and programs, providing technical supports and assistance to ECCD service providers after consulting with the coordinating committees at the provincial, city or municipal, and barangay levels. They are also responsible of keeping track of the advantages and the result of the ECCD services. The NEDA, DSWD, DepEd, DOH, DILG, DOLE, DA, DOJ, and NNC shall jointly prepare annual ECCD for work plans that will coordinate their efforts. They will combine the current program implementation policies that guarantee uniformity in the delivery of integrated services within the national ECCD system. Implementing the national ECCD program is primarily the responsibility of local government units who are also responsible for delivering basic public ECCD services, assisting parent cooperatives in organizing to start ECCD programs, ensuring that service providers of public ECCD programs under their supervision are fairly compensated, that sufficient funding is made available, and that their working conditions are sustainable for them to meet the national quality standards. Also, the management and operation of daycare facilities are also directly their responsibility. For the entire development of their children, the families and communities must take a part in a variety of local ECCD programs and projects. So, to guarantee the rights and complete development of children ages 0 to 6, the ECCD system was created as a group effort by numerous stakeholders. So, in national coordinating body, according to the Executive Order number 630, the CWC was converted back to its original status as an attached agency under the DSWD. In local coordination structure, ECCD coordinating committees will be set up at the provincial, municipal, city, and barangay levels. The law calls for the formation of ECCD coordinating committees at the local levels to enable ongoing interagency and multi-sectoral cooperation. The governor is in charge of the committee in the province. The mayor and barangay captain presides over the municipal or barangay. The Local Government Code of 1991 must be complied by the coordinating structures of the local level. Next is about the Section 9. So according to the Section 9 of this Act, community-based ECCD programs must be funded by a combination of public and private sources. Here, young children from families with greatest need and at least access to or ability to pay for private sector programs must always come first for all public ECCD program providers. In addition to cost-sharing agreements with LGUs and other funds from national government agency for technical assistance and support, the government must support public ECCD programs. These programs must be supported in all classes of municipalities, including those who are in urban areas through NEDA. Qualified LGUs will have access to funds via the Municipal Development Fund or other financing operations as determined by the DOF or the Department of Finance, and in accordance with the rules of Department of Budget and Management. The Council may create a trust fund to help LGUs upgrade and expand their ECCD initiatives. So with technical assistance and additional funding from DOH, primary health care programs, prenatal and postnatal care, growth, monitoring and promotion, and supplemental nutrition programs will continue to be financed through LGUs. And the LGUs will continue to provide support for the daycare program, parent effectiveness service, child minding centers, family daycare, and parent-child development programs through the building of essential infrastructure, the provision of facilities, materials, and equipment, and the payment service providers. The DSWD is responsible for offering technical support. The National ECCD program will be supported by DSWD, DepEd, DOH, and DILG. and they are also the one who will include the funds required in their respective annual general appropriations beginning with the fiscal year in order to reach the goal of national coverage within a 5-year time frame and sustain the program going forward. And lastly, the last four department said must coordinate with their activities and financial plans with the council bodies and coordinating the efforts of the LGUs.
The face of the future is behind our generation. We can look at them and we can help them. Who are they? The children. It's easy to see how important early childhood care and development is for the future of the Filipino children. With your help and support, together, we can make this dream into reality. Lastly, as Miss Maria Reza said in her Nobel Peace Prize speech, now it's time to build, to create the world we want. A world of peace, trust, and empathy, bringing out the best that we can be. Now, let's go and make it happen. Let's hold the line together. And my fellow Filipino citizen, the future is on our hand.